Good afternoon. I'm Jenny Niedenfuehr. I am a graduate research assistant with the Texas Epidemic Public Health Institute, also called TEPI, at UTHealth Houston School of Public Health. I'm presenting on behalf of our hardworking trauma-informed evaluation project team led by Dr. Paul Caccaro, and I'm here today to talk about understanding patient health outcomes after trauma-informed care transformation. Now, as part of our mission here at TEPI, we're committed to keeping Texans safe and the economy strong by strengthening the capacity and the resiliency of all Texas communities to respond to future infectious disease outbreaks. So since 2019, a primary care association has been implementing a comprehensive trauma-informed care training program in federally qualified health centers all across Texas. And these FQHCs primarily serve uninsured and underserved populations. Now, as part of our initiative, our team has been evaluating this trauma-informed care training program, which follows a train-the-trainer model. And the goal of this program is to prepare the FQHC workforce to respond to trauma and promote healing and community resilience. So what is trauma-informed care? Trauma-informed care is based on the understanding that traumatic experiences can have long-lasting impacts on a person's physical and mental health and well-being. It respects and responds to the impact of trauma, and it also underscores individual resilience and drives necessary organizational change. So the key pillars of trauma-informed care, for example, include safety, trust, choice, and collaboration. And these serve as a framework for providers in creating a safe and supportive environment in their clinics for their patients. It also follows the assumption that anyone we encounter may have actually experienced trauma, and this assumption guides providers in engaging with their patients accordingly with respect and humility. So based on the literature, we've found health outcomes associated with a person's history of traumatic events and adverse childhood experiences. So we identified several chronic and behavioral health conditions associated with trauma risk factors among adults and children. So these included controlled and uncontrolled diabetes, asthma, ADHD, and a number of behavioral health disorders as listed on the slide. Comparing these health conditions during patient encounters over time will help us understand whether or not these health centers are improving early identification of trauma in diagnosing and actually referring patients. Patient treatment adherence is also a noteworthy indicator of strong physician-patient relationships and improved health outcomes. So the aim for this project was to evaluate the effectiveness of a trauma-informed care implementation program in participating federally qualified health centers across Texas. We looked at patient encounters, screening, and appointment adherence among individuals with chronic and behavioral health conditions. So between 2019 and 2023, we analyzed electronic health record data using ICD-10 CM codes. These were used to track patients' encounters among those with chronic and behavioral health conditions. And then we employed a modified stepwise design, and this design enables health center clusters to transition one direction from controlled intervention at varying times. Health centers were not randomly assigned, but rather grouped into cohorts that adopted the intervention in a staggered manner. So this means that they started the intervention at different time points. Each center also acted as its own control, so we could compare patient outcomes before and after trauma-informed training initiation at 6-month intervals. As a result, all cohorts had different pre- and post-intervention periods. We also used generalized linear mixed models as the primary statistical method. This was used to estimate the effect of trauma-informed care, the intervention, on various patient health outcomes across 2 time points. A shared baseline April 2018, before the initiation of training that varied by cohort, and after initiation of training. And this method incorporates time periods and intervention status as fixed effects and cohorts the random effect in order to account for the data's hierarchical structure and repeated measures across time. So for our analysis, we examined counts. These counts were expressed as percentages relative to the total number of unique patient visits for each health outcome interest. And then we stratified the counts by patient age group and trauma-informed care training initiation status. The aggregate changes were also measured using percent change. And as shown by the figure on the right, we analyzed child and adult chronic patient health outcomes of asthma, diabetes, and ADHD, and also the behavioral health outcomes such as stress, adjustment, anxiety, attachment, and substance use disorders. We also looked at screenings, assessment, and appointment adherence. And notably, we found that all the examined health outcomes were statistically significant except for attachment disorder and uncontrolled and controlled diabetes in children, and also anxiety disorder in children. So we observed virtually no differences with these 4 health conditions. So based on the results of our study, the results indicate that trauma-informed care principles and training can be applied to improve health outcomes in federally qualified health centers. we found that many of the patient encounters increased and positively influenced most of the chronic behavioral health conditions evaluated. We believe that these improvements may be related to trauma-informed care training outcomes, including heightened provider awareness and improved trust and safety within these healthcare environments. Although some of the results were not statistically significant, they were still moving in the desired direction. So, to conclude this presentation and also provide directions for future research, more researchers needed to understand the long-term impacts of sustained trauma-informed transformation and health centers. There's also the opportunity to look at trauma-informed care effectiveness for other unexplored mental health and chronic conditions. All in all, we really hope that these findings can be utilized to enhance trauma-informed practices and trauma awareness in healthcare settings. Thank you.